Thank you, Marcy. Let's put that story into perspective now. The national government will set aside 38 billion shillings annually for the next 10 years to be able to equip hospitals across the 47 counties. This is an issue that has brought some friction between the two levels of government. Now, joining me in studio is Bomet Governor Isaac Ruto and the chair lady of the Kenya Medical Practitioners, Pharmacists and Dentists Union, Nelly Bosire. Thank you for joining us in the studio. Let's start with that, Bona Governor.
Yes.
Are the governors, first of all, Kenyans are wondering, are all the governors aboard? Do they back this arrangement by the national government?
In principle, we accept and we like the equipment. We have no quarrel with the equipment. The question is, what equipment is it? How is it supposed to be used? How did you identify which equipment? And also the financing of the equipment and the costing and where it will be placed, and our capacity then to utilize them. And the most important thing also is which equipment and for what, because there has been no consultation as to what sort of equipment we would require and where would we place them. There has been no background issues around there. And again, the question of the contracts. What am I signing into? We are told just affix your signature here. Don't worry, the contract is in Nairobi and it is so complicated you may not be able to read it.
There are reports that some governors have signed onto the deal, others have not. We have actually done that.
None has seen the contract, by the way. It is the MOU they are talking about. An MOU is not really a signing of the contract. And in the MOU, it's a very shallow document. But it also places a number of responsibilities on the counties, which with a lot of questions to be answered. And it gives a lot of burden on those counties, and we are not sure whether we have got the ability to meet those obligations.
Before we go to Daktari, there are reports that the county governments actually cannot on their own be able to afford this particular on the 38 billion that you cannot be able to afford this particular project on their own. That is why the national government is stepping in. What is your take on that?
No, if it is that the national government has not devolved enough funds for healthcare. But let me tell you something else. A number of counties, about 10 counties, have already purchased the dialysis equipment and ICU equipment and several other equipments similar to this. For example, Meru has all those equipments in one place. Now, what will happen with those other equipments? Will they be replaced? In Bomet, we have already installed dialysis machines. We are already dealing with that. It's already clear Kenyatta National Hospital is now handling about almost half what it used to do in 2012, but simply because these other counties have uptaken some of the other responsibilities. Like right now, we are able to do dialysis in Bomet. They are able to do it in Kisii, in Meru, in a number of other counties, including Kisii. So really, the question there is not that we have got no capacity. We have already moved forward.
Daktari, is this project feasible? Does it make sense to the counties?
Well, first of all, we have to agree that the initiative is in the right direction. We just have challenges with the execution. And speaking from the professional perspective, the first thing that worries me is that this was something that's been planned for, because this is our midterm planning, yes? And for you to do that, then you have to start building capacity in preparation. You don't buy your furniture for a house you have not built. That's the concern right here. So we're buying equipment. We haven't done capacity building to accommodate this equipment. The first thing is the infrastructure that needs to come with it. So if you give me an X-ray machine today and I don't have a radiology department, where do I put it? It means it's rusting in the store as I get ready, and I'm already paying for it. The second thing is, who is going to run this equipment? Kenya has dismally performed when it comes to creating specialists. We are graduating 700 doctors every year now. How many of these are we actually taking for specialist training? About 100 a year. How does 100 a year cover the deficit we require?
Let me interrupt you a bit. Yes. The national government is arguing that is not actually purchasing the equipment, is leasing. The maintenance of this equipment will be contracted to those companies, 3 of them, big ones, so they can be able to maintain. Does that make the deal better?
There are equipment where it makes sense to lease, but a lot of the things I have seen listed, you don't lease such equipment. You cannot lease a spoon for your house. That's how basic it is. You can't tell me that an operating set for theater, which is equipment you use every day, that you're going to lease that. You can't lease a pair of scissors. You buy that, because you're going to reuse it over and over and over again, and it can give you good service for a long time. It's expensive to lease that. But when we come to very high-tech equipment, sometimes it may make sense to lease them, because the maintenance is a bit costly, and you want it to be maintained by the very people who make it. The second thing is that where we are going in terms of how high-tech the ICT is becoming, they become obsolete very fast. So when you buy such equipment, in another 7 years, you can't even dispose them, because there's nobody who wants them. They're moving on to better technology. So those you come to agreements, and it's not a fixed period kind of agreement. It's a kind of agreement where we say, when we up technology, then we swap it for what's new and what's upcoming. But the rest of the basics,
yes,
not really.
Governor, let's talk about the constitutionality of this arrangement. Would you say that the national government is being allocated funds for functions which are clearly devolved, or is this what would call a conditional grant?
You see, the national government is allocating itself responsibilities that are already devolved. But nothing really stops the national government from giving us certain conditional support. But it does not say they give us conditional and tell us what to do with it. They would ordinarily say purchase equipment, but they would not go all the way to make all those minor decisions that they are giving themselves the responsibility to make. And in this case, for example, there was need for discussion with the counties. The constitution requires public participation. It also requires consultation and cooperation. Here is a situation where the national government just makes a decision and tells us implement it. We are saying it, and they keep telling us that this money is not your money. We are going to give you money. We are forgetting that this is Kenyans' money. It doesn't belong to the counties, neither does it belong to the national government. It is from one kitty where we share resources for the country. Now, the questions we are asking is about the propriety of these decisions, whether this is the best decision that you could make. For example, you can lease, you can get into the PPPs, you can buy, but you can also do placement. For example, I can place a photocopier here, and I will only pay according to the usage.
Yes.
Yeah? Instead of probably leasing. Most countries would prefer probably placement. We would probably have thought along those lines. But come to think of it, right now, if you just tell us that you want to give us the same equipment that we already have, like I already have in Longeza, this dialysis equipment, and I have more capacity than that, must I have the same equipment? I thought you would ask us, and then we would give you what we actually need.
Fair enough.
Yes.
Tomorrow you will be meeting the CS for Health,
yes,
Professor James Macharia. What is the way forward? What will you be able to
The most important thing first is, can he place the contract on the table? You know, he's telling us, just sign here on an MOU. When we ask him where is the contract, he says it is in Nairobi, it is very bulky, you can't see it. They are making a lot of noise and they have never shown us the contract. How would I, at this age, ask you to sign something you've not seen? And it says you'll be paying 95 million every year, and they tell us, never mind, we will give you the 95 million to give away. But it also says in that contract that you will indemnify both the national government or Ministry of Health and the owner of the equipment for any of several other issues that they have listed yes, in the MOU. How will I get all that? And then again, the most important question is the identification of the priorities for our counties, and then the facilities. Like if you are going to deliver them in one of the health centers that I have, where they are telling me I'm still building the health center, yes, but they are going to deliver very sophisticated equipment, and we don't even know the design of the places where to put this equipment, and where is the money to construct such an arrangement.
Indeed. Daktari, from a professional point of view, what is the way forward? What do you advise both sides of the divide?
Just as Governor says, there has to be adequate consultation, and there are things as professionals, whether we work in the county governments or we work in the national government, that we must acknowledge. We know our capacity to handle this. We're not ready for all this equipment. We need the central government to invest in training, specialist training for people to be able to spend this. Right now, we have doctors slaving in Kenyatta National Hospital for no pay because they want to go and improve their skills to come back and give this service. Can they invest in capacity building right there first?
Thank you.
The next thing is that what is the point of making the counties diagnose all these problems and they can't treat? So you make a governor here diagnose that this patient has cancer and this patient is sent to Kenyatta, where, as you have clearly stated, Kenyatta doesn't even have the capacity to handle that.
Thank you, Dr. Governor, one final thing very quickly. The transition period is coming to an end in August, and there are some 60,000 employees that were seconded to the county government by the national government, and there is a kind of a vacuum. They don't know if they'll be able to go back, because your county governments have been recruiting their own staff. What's going to happen to that, very quickly?
No, a number of staff, we are able to absorb them. In fact, they are already working. And we are simply hoping to finalize with the CAPS program. Yes. That is the rationalization. We are almost finalizing our structures, and everybody will fit into place. The staff we recruited are specialized staff for specific purposes. Therefore, there is no need for any panic amongst the staff. But on the other issue which we were just discussing, there is something I wanted to clarify. Recently, the Deputy President was on air saying that healthcare has actually deteriorated under the counties. I want to make it very clear that is nowhere near the truth at all. And on this question of the medical equipment, we told the Deputy President when we met in IBEC that we have not seen these things. Can you ask the minister to see us? He did issue an instruction that the minister will see us. That minister has refused to see us. Probably he'll see us tomorrow.
Thank you.
And I want to assure him that medical care has actually improved in the counties. There was no dialysis equipment in Meru. There was none in Bomet. There was none in
It's a discussion that we probably need more time to have. Thanks, Governor.
Right.
Thank you, Dr. It's a story we shall continue to keep an eye on in the coming days. Now,